Hi, I want to talk to you about retinols today. So retinols are vitamin A derivatives and they do wonders for your skin. So they help to plump up your skin and reduce lines and wrinkles and improve your skin texture. It will reduce pigmentation and even out your skin tone. It will reduce and unclog your pores so you get fewer blemishes and spots. It will improve your hydration level so your skin is soft and supple. There are a couple of things you might want to consider when you're thinking about retinol. One is how to choose the right retinol, and the other is how to cope with the side effects when you first start using retinol. So how do you choose the right retinol? Now, there are lots of different forms of retinols in the market. So what I want you to imagine is a ladder. So on top of the ladder is retinoic acid, which is the most active form of retinol. So any retinol has to be converted to retinoic acid for it to then have an effect within your skin. And that's the only ingredient your skin will respond to. So if you then picked a retinol at the bottom of the ladder, so it's a very weak form of retinol, it then needs to go through a lot of steps, and only a small proportion of the large amount of product you're using is going to be converted to the active form of retinoic acid for it to have an effect on your skin. The medical grade ones are a couple of steps away from the retinoic acid, so they are a much more efficient way of delivering that retinol into your skin. You get what you pay for. The retinols, the medical grade retinols, also have this advantage of being encapsulated. So they're held within a molecule, and that molecule's job is to deliver that retinol into the right level within your skin and not just sit on the surface of the skin. So it will release it into the right level, and that release will be a slow release process, so that it will be released all throughout the night while you've applied once you've applied the product, so that it has a slower effect within your skin, which is what it needs to do. It will be your skin will be drip fed that retinol rather than all delivered at once. So that's the advantage of using a medical grade retinol. Now, you need to remember that retinol has to be used at night, and you have to cleanse your face in the morning and wash off any remaining retinol because it gets broken down by UV light. And also retinol makes your skin very sensitive to UV radiation, so you have to be using a sunscreen during the day. Okay, the next point is how do you cope with the side effects that you get when you first start using retinol. So your skin, when it starts being introduced to retinol, has this reaction, and that reaction is normal. So that can happen within a couple of days of starting retinol, and it can last up to 3 or 4 weeks. And that's a normal reaction that everybody will experience when they use a retinol. And if you aren't experiencing any effects, then perhaps you're not using the right retinol or the right strength of retinol. Because once your skin is introduced to that retinol, your skin cell cycle, or the churning out of new cells, that rate has increased. And when that increases, you are producing very younger skin cells. Younger skin cells are coming to the surface, and they're not used to the external environment. So they slough off much more readily than the skin you would have had before you started using retinol. So it increases your skin turnover, and by doing that, it's making it more susceptible to the environment and flaking off. You also get a lot of redness, as well as that sort of flaking, soreness and discomfort, itching and tight skin. But that's all common side effects of the retinol. And one way of combating that is to start very slowly. So you would just start your retinol maybe once a week, and then you increase it to once every 3-4 days. And then once that your skin is used to that and you're not getting any side effects, then you'd increase it to once every 2 days or every other day. And some people can only use their retinol once every other day, but that's okay. It will still do its job. So, even using it every 3 days is still better than not using a retinol. The other important thing that I hear about is lots of adverts saying, I used retinol and within a week my skin has got better. Well, that's not quite true, because the way the retinol works is quite a slow process, because you're changing the way the skin cells behave and how the skin cells multiply. So that's not going to happen within a week in terms of giving you the positive effects. So although you get the side effects come on earlier, the actual benefits of using retinol you wouldn't realize until you've been using it for a good few months. So it's impossible for you to be getting the benefits of using retinol within a week or so. So that claim is not quite right because it doesn't quite work with the science of retinol. So I hope I've covered most things. If there's anything else you want to know about, get in touch with me and I'll do my best to answer it. Take care.